Imagine an organ in your body that surgeons can remove a significant chunk of, and, well, it often just grows back. It sounds almost like science fiction, doesn't it?
It really does.
Today, based on some really fascinating material you shared, we're diving deep into hepatectomy. That's the surgical removal of all or part of the liver. Think of it as understanding maybe the ultimate in organ resilience.
Exactly. Now, you might hear hepatectomy sometimes when people talk about full liver transplants, but our focus today is really on those partial removals.
Right.
We want to unpack why doctors might need to do this, take out a piece of the liver, the incredibly complex ways they actually manage it, and, crucially, what makes the liver so special, so unique in its ability to bounce back.
And we're looking at info from Wikipedia and also a really detailed document you sent over, which we're just calling textile inserat for this chat.
That's the plan.
Okay, let's get into it then. This idea, removing part of the liver, it's not something they just thought up yesterday, right? It has a history.
That's right. And what's interesting is how relatively recent that history is, in the grand scheme of surgery. Our sources point to the first reported cases by Dr. Ikio Honjo in Japan, 1949,
Okay.
and then shortly after, Dr. Jean-Louis Lortat-Jacob in France, 1952. And that French case is really illustrative.
How so?
Well, it involved a 58-year-old woman whose colorectal cancer had actually spread to her liver. Its success really highlighted a key reason why we still do hepatectomies today.
Ah, okay. So that leads us straight to the big question. Why would someone need a piece of their liver taken out? I mean, it sounds like a pretty major operation.
It absolutely is a significant procedure, and the reasons vary, but they tend to fall into a few main categories. As that early case showed, the most common reason is for malignant neoplasms.
That's the medical term for cancers, right?
Exactly, cancerous growths. This covers both tumors that start in the liver and, importantly, those that have spread to the liver from somewhere else.
Okay, so cancer is the main driver. What specific kinds of liver cancers are we talking about?
Well, for cancers originating right there in the liver tissue, the most common one is hepatocellular carcinoma, or HCC.
HCC. Got it.
Yeah. And this often pops up in people who already have some underlying liver problem like chronic hepatitis or uh, cirrhosis.
Makes sense.
Then there's cholangiocarcinoma, which is a cancer of the bile ducts inside the liver. But just as important are the secondary or metastatic liver tumors.
Metastatic, so they started somewhere else entirely.
Precisely. And our sources really emphasize this. Cancers that spread from the colon and rectum are particularly common culprits found in the liver. And importantly, they are often treatable with surgery.
So even if it spread, surgery might still be an option.
Yes, potentially. Think of it like a seed that traveled from another part of the garden and took root in the liver. The material you shared also mentions that breast and lung cancers can also spread to the liver and sometimes be candidates for surgical removal.
That's quite something. It makes sense, though, if the spread is contained maybe just to the liver, removing that part could be curative, potentially.
That's often the hope, yes.
What about reasons that aren't cancer? Is it ever done for other things?
Oh, absolutely. Hepatectomy isn't exclusively for malignancy. There are non-cancerous or benign liver lesions that might still need removing.
Like what?
Well, for instance, hepatocellular adenomas. They aren't cancerous themselves, but they do carry a small risk of bleeding or potentially turning malignant down the line. So often removed just in case.
A precaution.
Right. Then you have things like hepatic hemangiomas, basically tangles of blood vessels. They might need surgery if they cause symptoms. And another one is focal nodular hyperplasia, usually harmless, but sometimes removed if it's causing pain or they're not sure what it is.
Okay, interesting. So growths, cancerous or not, any other reasons?
Yeah, the sources mentioned a few less common ones too. Things like intrahepatic gallstones. These are gallstones forming within the liver's bile ducts.
Inside the liver itself.
And parasitic cysts can sometimes be a reason. We should also probably give a quick mention to living donor transplantation.
Ah, where someone donates part of their liver.
Exactly. That requires a partial hepatectomy on the healthy donor, of course. And finally, sometimes severe trauma, a bad injury to the liver, might mean removing the damaged section.
Okay, so we've got a good handle on the why now. The how. How on earth do surgeons actually remove a piece of the liver? That sounds incredibly difficult.
It is definitely major surgery, almost always requires general anesthesia, and historically, getting access to the liver meant some pretty large incisions.
Big cuts.
Yeah. One was the bilateral subcostal, often called the chevron incision, runs right across the upper belly, under the ribs. Sometimes they even extended that upwards, creating what they call the Mercedes-Benz incision.
The Mercedes-Benz, seriously, you can sort of picture the shape. Sounds quite invasive.
It was. But, surgical techniques has come a long way. A much more common approach these days is the J incision starts under the right ribs, curves up towards the middle.
Okay, a bit smaller maybe.
Generally, yes. And there's also something called the anterior approach, which became more feasible with a clever technique called the liver hanging maneuver.
Liver hanging maneuver.
Yeah, it helps lift the liver. And mirroring trends across surgery, minimally invasive methods are used more and more.
Like keyhole surgery, laparoscopic.
Exactly, laparoscopic or even robotic surgery. Definitely gaining ground for liver resections.
I imagine that makes recovery a bit easier.
Oh, for sure. Often less pain, smaller scars, quicker return to normal life. Now, when they actually remove the liver tissue itself, there are sort of two main ways.
Okay.
There are anatomic resections. These follow the liver's natural functional segments. There's a map, basically, called the Kuno classification.
Like little zones within the liver.
Kinda, yeah. Each with its own blood supply and bile drainage. Removing tissue along these lines is generally preferred because it can minimize bleeding and the risk of bile leaks. You're working with a natural plumbing, so to speak.
Right.
But in some situations, they might do a non-anatomic resection, sometimes called a wedge resection, just taking out the specific problem area without strictly following those segment lines.
And I think I saw something in the notes about controlling bleeding during the operation. That must be critical.
Absolutely critical. The liver is very vascular. A key technique they use is called the Pringle maneuver.
Pringle, like the crisp.
Yeah, named after Dr. Pringle. It basically involves temporarily clamping the main blood vessels going into the liver, the hepatic artery and portal vein.
So turning off the tap for a bit?
Sort of, yeah. Reduces blood flow while the surgeon works. It's very effective, but there's a small catch.
Yeah.
Temporarily cutting off the blood supply like that can potentially lead to something called reperfusion injury when the blood flow is restored.
Reperfusion injury.
Yeah, imagine blood rushing back into tissues that were deprived of oxygen. It can cause a bit of damage itself. It's a complex process in the liver, but it's something surgeons are very aware of.
Okay, so even with all these advanced techniques, there are still potential hurdles, complications.
Oh, absolutely. Any major surgery has risks. Bleeding, as we mentioned, is a major concern with the liver. Sometimes it can be serious enough that the patient needs to go back to the operating room.
Sure.
And our sources suggest the amount of blood lost during the first surgery can actually impact the overall outcome later on.
Right. What else can go wrong?
Another potential issue is a biliary fistula. That's basically a bile leak. Sounds unpleasant, and it is, but fortunately it can often be managed without needing more surgery, maybe with drains or other procedures.
Okay. Any other common issues?
Well, pulmonary complications, lung issues like atelectasis, where part of the lung collapses slightly, or pleural effusion, fluid building up around the lung.
Yeah.
These are fairly common, especially risky for people who already have lung conditions.
Uh-huh.
Infection is always a risk with surgery, though the sources say it's relatively infrequent here. But probably the most serious potential complication is liver failure.
Right. If the remaining part can't cope.
Exactly. The liver does so many vital things. If what's left isn't enough or can't recover function quickly enough, it's a major problem. This is a really significant concern when doing this surgery for HCC in patients who already have cirrhosis, because their liver function might be quite poor to begin with.
I see.
And it's also a concern if someone needs repeat liver resections over time.
That all sounds pretty daunting, but the information also seemed positive overall, suggesting that outcomes are often good now.
Yes, very much so. The consensus really is that liver surgery has become much safer, provided it's done by experienced surgeons in specialized centers.
Like cancer centers or transplant hospitals.
Precisely. Places with the right resources, the right expertise, the whole team approach. And like with many complex surgeries, data shows that surgeons who do a high volume of these procedures tend to get better results.
Practice makes perfect, I guess.
To some extent, yes. Experience really counts here.
And it sounded like it's not always just the surgery. Sometimes other treatments are involved.
That's a great point. Often, it's a multidisciplinary effort for the best outcome. This might involve chemotherapy, either systemic, traveling through the whole body, or sometimes regional, delivered right to the liver.
Targeted chemo.
Right. Or biological therapies, which target specific pathways involved in cancer growth. And importantly, sometimes these treatments are given before the surgery.
Why before?
The goal is often to shrink the tumor first. That can make the surgery itself easier, maybe allow the surgeon to remove less liver tissue, which is always good.
Oh, okay.
For instance, the chemo drug oxaliplatin is mentioned for colorectal metastases that have spread to the liver. And for HCC, a technique called chemoembolization delivers chemo directly into the tumor's blood supply.
Liver.
And going back to the surgery itself for a second, surgeons also use specific tools like special liver clamps. Lin or Chew clamps are mentioned to help minimize blood loss during the actual removal.
Got it. So after the surgery's done, what's the typical recovery look like?
Well, post-op care involves really close monitoring vital signs, of course,
Sure.
but also specific tests to check how well the remaining liver is functioning. Pain control is obviously a priority.
Naturally.
And patients are encouraged to get back on their feet, start eating and drinking as soon as it's safe and they can tolerate it. Early mobilization is key.
How long in the hospital usually?
Typically, the stay is somewhere around 5 to 10 days, but that can definitely vary depending on how big the resection was and how the individual patient is recovering.
Okay. Now, let's circle back to maybe the most incredible part of this whole story, the liver's amazing ability to regenerate. How does that actually happen?
This really is the liver's superpower, isn't it? Its regenerative capacity is just phenomenal. After a partial hepatectomy, the remaining liver tissue undergoes something called hypertrophy.
Hypertrophy.
Yeah, it means the existing liver cells, the hepatocytes, they enlarge, and they also start dividing, multiplying. So the liver effectively restores its lost volume and, crucially, its function over weeks to months.
It just grows back.
Essentially, yes. It's driven by complex signaling pathways, growth factors like HGF, hepatocyte growth factor, and EGF, epidermal growth factor, play big roles. It's a phased process, but the end result is remarkable.
And that regrowth is obviously vital for recovery.
Absolutely essential. It's the reason why surgeons can remove significant portions of the liver in the first place. It's like the organ has this incredible built-in backup and repair system.
Just amazing. So, putting it all together, what are the key things that determine how well someone does after this surgery, the prognosis?
Several factors really play into it. The type and stage of the tumor, if it was cancer, our critical earlier stages generally mean better outcomes.
Makes sense.
The underlying health of the liver itself is also paramount. A healthier liver going into surgery is much more likely to regenerate well.
Right, like if there wasn't already cirrhosis.
Exactly. And as we've mentioned a couple of times, the skill and experience of the surgical team and the center where it's done are really significant factors.
But the overall picture has improved.
Definitely. Thanks to all these advances, better surgical techniques, better understanding of liver regeneration, better post-op care survival rates have improved significantly, and complication rates have dropped over the years.
That's genuinely impressive progress. And just as a final detail, I noticed the name itself, hepatectomy. Where does that come from?
Ah, yes, the etymology. It's straight from ancient Greek. Heper was the Greek word for liver,
Kepar. Okay.
and etectomy comes from the Greek word ektomi, which means to cut out or remove,
So literally liver removal.
pretty much, or removal of a part of the liver in the context we've been discussing.
So there you have it. You've just taken a real deep dive into hepatectomy. We've covered not just what it is, but the intricate details of why it's done, how surgeons approach it, the risks involved, what recovery looks like, and of course, that truly remarkable ability of the liver to regenerate.
It's quite a journey, from those early operations to the minimally invasive techniques and complex biological understanding we have today.
It really is.
Yeah.
And considering that extraordinary regenerative power, well, it really gets you thinking, doesn't it? What are the future possibilities there? Could we somehow harness that ability, maybe for other organs or for different types of treatments entirely? It makes you wonder about the limits, the ultimate capacity of our bodies for healing and renewal.